Good. Well, welcome to True Health Tuesdays. Tonight we're going to start it off a little bit different. We've got a 4-minute testimonial. Now, this guy is probably one of the nicest, most courageous guys I know. He actually had surgery scheduled where they were going to remove his knee. They were going to cut the top bone. They were going to cut the bottom bone. They were going to put a, Teflon, whatever, titanium knee. Now, knees only last about 10 years. This guy's young. He's a kid. He's only 66. Okay, so when you get 76, do you want another operation? When you get 86, do you want another operation? No. So he actually had to change his belief system. But here's a brief 4-minute video that's actually pretty cool.
Go ahead. Okay, my name is Robert Estrada, and I was scheduled last November 21st to go in for a total knee replacement. I've been having trouble with my knees, or my right knee, for forever, for quite a few years, and the pain level was such that I was already willing to have a total knee replacement. I was told that I was bone on bone. I point blank asked several orthopedic surgeons if it was possible for the body to regenerate cartilage, and they told me absolutely not. You have to have a knee replacement now. After seeing Dr. Bergman, he did a workup on me and said, "You're not bone on bone. If you were, you wouldn't be walking as you are, and we can get you well." He did a full workup on me, and he showed me. It's the first one that ever took an X-ray of both knees together. And he said, "I took this X-ray for you, not for me. I already know what. Tell me which one was the bad one." They both looked as bad. He said, "I'm not going to tell you that your cartilage is not thin. It is, but you're going to regenerate that cartilage, and I'm going to prove it to you." He said, "Well, now let me show you your spine," and that's where the problem was. That was the source of it, and I think that. He's right. I've done other work with other people that have kind of pointed out that I was a little bit twisted up there, making me walk incorrectly. I had another clinic tell me one time, "So you can get a knee replacement if you want, but it'll probably be, I don't care if it's made out of titanium, ceramic, or whatever, it's probably going to last you maybe 10 years, and you have to do it again by the way you're walking." I go, "Well, what do you mean?" And I had just some alignment issues, shall we say. And coming over to seeing the Bergman family chiropractic has really made great inroads. I haven't taken as much as an aspirin for now almost 5 months now. And he asked me, "Are you taking anti-inflammatories?" I told him, "Yeah, kind of like popcorn." He goes, "It's bad for you." "Yeah, I know, the liver, it's killing the liver and the kidneys and all that. What's a good alternative?" He gave me good alternatives on that. What he gave me was a plan that was like a triad of constant chiropractic adjustments and care, exercise. He gave me certain exercises to do, which I do religiously, and diet. And he told me, "I want to wean you away from an acid diet and get you more alkaline, which is helping the body heal itself." And what I learned here was that he said, if the body has like 30 trillion cells, and over the course of about 14 months, they all, at varying rates, they regenerate themselves, and a broken bone can heal itself in 6 weeks, you don't think the body knows how to heal itself? Anybody tells you that you're bone on bone, you need a total knee replacement, like telling you the world is flat. So
you don't need surgery anymore?
I don't need surgery anymore. The pain level is just gone. Every once in a while, I might have a little bit of during the weather or whatever, with barometric changes. But I've got these exercises that I was given to do, and it helps that. And I'm taking some of the fish oils and all that, and it's all worked out very well, and no surgery. All this has taken place in only 3 months. So I'm really looking forward to the rest of my life now. And I have something else too, is one of the things that I've told friends about, and they get concerned about, "Oh, well, insurance cover this and that." My question to them is always, what is your pain worth to you? That's something to consider, because I'm healing.
Isn't he cool? Yeah. Now. Good. Now we can start. I mean, but that takes a lot of courage. You know, you get a surgery scheduled. I mean, that's a big deal. So when Da Vinci said the human foot's a masterpiece of engineering, we have to start appreciating ourselves because it's a whole different world. When I talk about knee regeneration, okay, now it's been nearly 25 years, I speak with great authority. I was actually walking across the street, had both my legs broken. I was hit by a car. Now, you're going to learn a lot about anatomy. The bone that the big femur that rides on is called the tibia. They were split lengthways. Now, then I also fractured my sternum, bruised my heart and liver, fractured my skull, which was good because I was unapproachably good looking. Now I'm, you know, I have more character, okay? And then my front teeth were knocked out. Now, so I mean, I saw the medical world, and they were saying, yeah, no problem, you know, we can give you medications and things and keep you comfortable. Let me tell you, the things that they give you, like Advil, Motrin, Aleve, those are non-steroidal anti-inflammatories. They destroy joint cartilage. Tylenol is the deadliest drug in America. I mean, the only one that I really dug was morphine, but that destroys your lung capacity and it predisposes you to brain damage and addictions. That's not a good line. Now, with what I was doing before, I saw the body get cut and heal. I've broken things before, and I know it heals. So I thought, why can't the knees heal? And so I ended up getting into anatomy and physiology, and I taught human dissection for 8 years. So I've dissected hundreds of knees. And luckily, over practice, over the last 17 years, I've actually experimented and found out that knees do regenerate. Now, but it takes a change in belief system. Now, I love this bodybuilding group. You have to be 75 years old to join. So I got another 21 years before I can even join. Okay, yeah, there's a celebrity. So when I just played your testimonial. Now, but all the books that I've written about curing fibromyalgia, do you need to change your belief system on that? Absolutely. Now, what happens is patients typically follow the belief system of the doctors. So if you're in, like, have you ever heard of cancer? You know, if you join a cancer support group that you're going to die early?
I bet so.
Okay, because what do you talk about in those groups? Okay, you don't talk about health and nutrition. So you start talking, or you can fall into the belief system of the doctor, particularly if they believe that you can recover from incurable diseases. So what I want to do tonight is make you have an appreciation for how beautiful you are inside. I mean, you better walk by a mirror and smile. I mean, your foot, you're talking 26 different bones. Okay, when you look at it, 100 tendons and ligaments, and it's formed in a beautiful arch, so it's strong and flexible. What's stronger, concrete or a foot? A foot, you're right. I've seen people break concrete blocks. I've broken concrete blocks with my foot. I've broken boards with my foot. You know, it's amazing, but it's still flexible and strong. I mean, that's incredible. And if you've ever watched ballet, I love ballet. I mean, just to be the same species. I'm not going to be a ballet dancer, but I mean, to know that you can do that. Now, the knee is huge. This is going to be the first one that we're going to take a look at. It doesn't bend. It pivots. Okay, and when we look at this, the top bone, the big one, the thigh bone, is called the femur. It glides on this shelf called the tibial plateau. And when you look at it, it's not symmetrical. And this is the toughest part because a lot of, like when you look at knee braces, they typically have the same hinge, right? One on the inside, one on the outside. Not only is that foolish, but it doesn't allow for the dynamics of how the knee actually works. This is the top of the tibia. That's the inside portion of the knee. The other one's the outside. So it actually pivots twice as much on the inside as it does on the outside. Now, when in injuries, has anyone ever heard of an ACL injury? Well, there's actually a terrible triad of Donahue, okay? And what happens, if the knee is hit from the outside, okay, or jammed from the outside going in, and that's typical in football or a lot of sports injuries, you tear three things in order. You tear what's called the medial collateral ligament, and that's the ligament that runs on the inside part of the joint. Now it's interesting to note that when the two bones come together, you got the tibia here and the femur here, you've got one ligament on the inside called the medial collateral ligament, one ligament on the outside called the lateral collateral ligament. Now the medial one is attached to meniscus, and meniscus is this pink area here. If you ever saw meniscus in real live dead bodies, okay, if I say that, but you know what I mean, right? Okay, real cadavers, yeah. It looks just like Tupperware. It's the coolest looking thing you ever saw. And so it's flexible and strong. Now this is where doctors get confused, because on that tibial plateau, you've got a constant force, okay, of pressure where that bone is coming down on it. And they'll say, hey, it's avascular. Avascular means there's no blood vessels there. Of course not. Want to see me compress that tibial plateau? Want me to do it again? I can do this all day long. But my knees are not going to run out of blood, because the way the design is, there's so much compressive force loading on top of that there's no blood vessels. So the knee joint itself has to get its nutrients through the synovial fluid, through the membrane, because those two bones are two bones coming together, surrounded by a synovial membrane, and the membrane is like a super filter system, where it's a super filtrate of blood that gets in there, and that's how the joints get nourished. But when we're looking at all of these structures, the ligaments, the meniscus, the tendons that support the bone that come around it, the reason that the medical world doesn't understand that it can regenerate, what's their primary line of therapy? Non-steroidal anti-inflammatories, yeah. That destroys proteoglycan. That's actual building blocks of the cartilage. So you're taking something that makes you feel better, but you're destroying, because on this bone here it's almost like a Teflon coating. It's called cartilage. It's living. There's actually blasts or cells on there called chondroblasts that build the cartilage. And you already know this, because if you have a knee problem and you sit for a couple of hours, what's it like when you first stand up? Yeah, you feel like Tin Man, oil can, it hurts. Okay, but then you move around a little bit, you lubricate the joints. Now, the beauty of this is I'm going to lubricate my knee right in front of you. Wait, did I do that too fast? Okay, I'll try it again. I'll slow it down. Amazing, isn't it? I know. It just blows me away too, that I'm able to do that in front of a... Well, what I did was I walked. When you walk, that knee joint opens up and it creates a negative pressure. The calf actually pulls that knee joint open, creating a negative pressure, allowing the superfiltrate of synovial fluid, the superfiltrate of blood, to get in there and nutrify and nourish it. And also, too, when you look at these ligaments, just like a muscle, if you put them under strain, they can actually regenerate. Okay, does that make sense? So when we're looking at the anatomy and physiology, it moves twice as much on the inside as it does on the outside. Yes, absolutely, there's no blood vessels on the top of that. The outside edge of the meniscus does have blood supply, but on the middle it doesn't. And it shouldn't have it, because it is under such compressive force loads. So when we look at this, when we're talking about regeneration, you've got to talk about healthy blood that gets in that synovial membrane to renutrify it. And then we have to talk about the normal motion, how we separate it out and pull it apart to strain those ligaments to build them up. Okay, does that make sense? Now we're going to look at the muscles. Now, you've heard of a fulcrum and a lever. Okay, I think it was Pythagoras that said, give me a fulcrum long enough, we could lift the world. Wait, no, it wasn't Pythagoras. Who was that other mathematician? Archimedes. Oh, I just saw the special on him. Brilliant guy. So when we look at the knee, we've got muscles all around it. And you've got this kneecap called a patella. And it is the fulcrum. This is the absolute most beautiful thing. And you've got a couple of other sesamoid bones that are encased in tendons to take some of the stress off of the muscles. Now, it happens that when I was 22, I actually shattered my right patella. So I got a chance to learn about that. I fell off a 3-story building. I landed on concrete. And yeah, it was, so I guess I was destined to teach this stuff. Now, when you look at this, you've got two muscles that guide the action of it. Okay, one on the inside, one on the outside, vastus lateralis and vastus medialis. Now, those two muscles, if they're not guiding that patella, that fulcrum, they're going to be off. So then you start looking at this and say, because most of the knee problems that I fix aren't really involving the knee. They're going to involve the mechanics of the foot, they're going to involve the calf, they're going to involve the hip or pelvis, they're going to involve the innervation of it, they're going to involve the tracking of that patella, they're going to involve healthy blood supply or unhealthy blood supply, healthy nerve supply. What's in crazy world, we think a knee problem is a knee problem. That's ridiculous. That's like saying depression's a brain problem. No, that doesn't work either. You know, I mean, we have to look, you got to do a little bit more detective work, but you got to also appreciate how human beings are. Okay, so when you look at this, we've got the muscles that surround it. So the tracking of the patella is really good. Wait a second. The muscles control the tracking of that patella. And the joint doesn't move like this. It moves like a screw, so it moves twice as much on the inside. So that's pretty dynamic. Now, what controls the action of the muscles? Say nervous system.
Nervous system.
Oh, you're so right. It is. So wait a second. So the nerves that come out of the low back govern the tone of those muscles, and so that's dynamic. Now, oh God, I'm forgetting about the foot. Let's look at the foot. The foot's a coiled spring. Okay, now, have you ever heard of plantar fasciitis or bunions or clawfoot? We're going to cover all of that. But most of those deformities are an adaptation from long-term problems with the coiled spring that it should be. See, the foot has got 4 arches. Okay, you've got 2 running lengthways, 2 running crossways. And it's just such a neat design. It glides, and this is how normal people walk. But what happens, if you pinch the nerves in the low back, like let's say you golfed 8 hours a day, do you think you might develop a back problem? Yeah, of course. Because golfing under that swing increases the pressure on the L5-S1 disc, the disc right at the base that supplies that foot and calf 8 times normal. Sitting increases it 5 times normal. No, I want to hear, wow. Okay, yeah, but you don't feel it. So then you start thinking, wait a second, a sedentary lifestyle, that's going to compress the nerves, causing the foot to flatten out. That's going to change the mechanics. So no longer will people glide and smooth walk. What they're going to do, and you'll see this in the mall, they start walking where they move their hips. You see people walking like this? Oh, yeah. Okay, so now wait a second. So that means sedentary lifestyles or weak intrinsic muscles of the foot, so that causes the foot to flatten out. Now you've got a good design feature on there, super strong tissue on the bottom of the foot, and this is called the plantar surface. So if that foot flattens out, is that going to strain that tissue? Yes or yes? Okay, good. So strained tissue is going to inflame it because the body's tearing it down and the body wants to build it up. And we say itis for inflammation. So that would be plantar fasciitis. Ooh, so plantar fasciitis isn't a disease. It's weak intrinsic muscles of the foot. Can you imagine a barbaric society that would shoot that with cortisone? How foolish. Okay, because when we look at it, oh yeah, flat feet run in my family. No, flat feet don't run. They don't run in families, okay? We never would have caught the antelope, okay? Sedentary lifestyles do. Okay, so that's something that we got to solve. So when we look at this, so the loss of those arches of the foot, that's going to cause somebody to change their mechanics when they walk, yes? So that means instead of having a normal knee planting, that means they're going to be using the pelvis to walk incorrectly. Now, if you work the pelvis incorrectly, that's going to destabilize that pelvis, and that's going to compress the nerves as well. So does that mean that flat feet lead to difficult menstrual cycles, prostate issues, bowel and bladder problems? Wow. I know. So it requires a little bit more detective work, but do you have more appreciation for the lower extremity? Oh man, if we ever do a talk on wrists, you're going to be blown away. But this, and now, you got to figure the heart's up here, If you've ever heard that soldiers, if they stand at attention with their legs locked, they pass out. Okay, but if they leave their knees a little bit, they start, I'm doing accentuating, and most people don't weave like this unless you've seen Shooters Next Door. But I think that's a cerebellum issue. Okay, so but you weave a little bit like this. What that does, that tightens up and relaxes the calf. Inside of the calf, you've all heard of the Achilles tendon, right? For a board question, what's the other name of the Achilles tendon?
Achilles heel.
Nope. Triceps serrae. So now you know one of the questions on the board. Yeah, I taught the board review. Okay, triceps serrae, that means there's 3 muscles that attach to it. So when you look at it, it's like quadriceps is up here, there's 4 muscles that attach to that. There's 3 muscles that attach to that Achilles. Medial and lateral gastrocs, and then we've got the soleus. The soleus is the neatest muscle you've ever seen. It actually is a pump. So every time this foot pumps or does that, it actually allows more blood to drain out of the foot, that allows more fluid to flow into it. And we're going to go over how you have to have this pumping action in order to have healthy blood supply. If you have healthy blood supply, then you get healthy synovial fluid production. You have healthy synovial fluid production, it takes the pressure off of that knee. Okay, so, nope, questions at the end. If we weren't recording, I'd be answering them. Now this is a perfect knee. Actually, 2 perfect knees. Now, she was told, because she had knee pain. She had knee pain. Do you think this could be referred from the low back, from an unstable pelvis, from a flat foot, now that you're educated? Her orthopedic guy says, nope, your grandpa had knee surgery, your grandma had knee surgery, it must run in your family. No, messed up knees don't run. I know, I'm going to keep using that bad humor. Okay, this one's a fake knee. Okay, this is what, I'd actually change your name to Bill in some of the slides, but this is what you avoided. Okay, and you can see what they do is they take a steel shaft, bore out the hole of the leg, and then they just beat it in there. Okay, and then they take a little saw and then they beat it in the femur and then they connect it up. It's brutal. It's brutal. I didn't work on cadavers that hard. But what's interesting is her back pain went away when we got her pelvis stabilized and we got her foot working correctly. Okay? And now here, patellar tracking. And this is a slide because I travel across the country teaching other doctors how to check to see, because you're never going to correct a scoliosis unless you correct for the patellar tracking. You're never going to correct fibromyalgia unless you check for patellar tracking. You're never going to correct virtually any low back issue unless you check for patellar tracking. Why? Because if the tracking of the patella is off, you're always going to have altered gait. Okay, does that make sense? If you have altered gait, that means the pelvis is going to be completely unstable. So when I'm teaching doctors, I'm telling them how to pull it one way, pull it the other way. So I'm not going to teach you how to check for patellar tracking. Just know that it's vital. What's wild is, since you've got one muscle on the inside, one muscle on the outside, to check the strength of those, you're going to extend it out. This is how you work both of them. But if you have, like some of the exercises I'll give some of my patients, sometimes the foot will be turned out to strengthen one muscle, the vastus medialis. Sometimes it'll be turned in to strengthen the other muscle. What's kind of interesting, if your muscles hurt or your knee hurts when you're walking downstairs, typically it's a vastus medialis problem. That's the muscle on the inside. If it hurts going upstairs or uphills, typically it's the other muscle, vastus lateralis. So I always tell them, you're either going to do Jerry Lewis or Charlie Chaplin. Okay, Lewis and Chaplin. So now this is a double knee that I take, and I always take a double knee because they always say it's bone on bone. If you can't bend it, it probably is bone on bone. If you can bend it, I guarantee it's not bone on bone. Why? Because it wouldn't bend. Okay, does that make sense? It's not rocket science. This should be like basic stuff. But when you're looking at this, you can see a space here and not a space there. Neither one of them looked that good. Okay, but on this patient here, it was this one on the left-hand side that was the worst. Now what's interesting, you can see the shadow of the patella, how it's way off to the side. That patella should be in the middle. So you could see in the back row a patellar tracking issue. So that means that there's got to be some kind of problem in the low back. There's got to be some kind of pelvis issue. There's got to be some kind of foot issue that's contributing to this. Does that make sense? Yeah, sure enough. Now what's neat is I'll typically give an exercise of using ankle weights to force that knee joint open on the first visit. Do you know why? Because I want that miracle thing, because there's a trust factor here. You got a person like this who's intelligent, educated, that's been to the finest orthopedic surgeons in the world. Yes, that is true. If you have a knife, everything looks like surgery. If you have a hammer, everything looks like a nail. So are you going to get a non-surgical opinion from a surgeon? No, that's pretty much it. Okay, so when you look at this, you know, after you swing the weights on the very first visit, there's going to be a symptom relief. Now, his symptoms started to decrease after about 3-4 weeks. Okay, reduce the drugs. And here's the post x-ray. Now, it's hard to see, but there's a little bit more of a gap there. There's a little bit more of a gap there. So both sides are regenerating. That's pretty cool. Let me show you where the real problem was. This is the lumbar spine. Now, standing up straight. Now, when we talk about neurology, like we talked about neuropathy last week, if somebody has pain that comes right down to these two fingers, that's the 6th cervical nerve root. That's the 8th cervical nerve root. The 7th cervical nerve root we usually use for waving hello and changing lanes. Okay, but also, I mean, you'll see, you know, somebody will say, oh God, I got pain right up here. Yeah, that's about T4. Okay, the inguinal pain, that's going to be the thoracolumbar junction. L3 goes to the knee, the 3rd lumbar. The apex of this bend is the 3rd lumbar. So you're talking a 14-degree bend before, 90 days later it's down to 9 degrees. So are we regenerating the discs in the low back? Absolutely, that's taking massive pressure off. What do you think that does to the patellar tracking? I don't know, let's take a look. So we look at this, we see the patella way off to the side. It's now more towards the midline. Wow, isn't that fun? I mean, when you look at x-rays, it's just like, wow, it's like Sherlock Holmes stuff. It's total detective work. Okay, so this is one of the best exercises to work and to open up the knee. Now, if I can open up the knee just by walking, what if we really force it open? We pull that baby open. You know, you'd put like 5 or 10 pounds of force to pull it open. Now, when I work at the gym, have you ever seen kettlebells? Yeah, I'll use about 15 to 20 pound kettlebells. The only reason is because the hole on the kettlebell is big enough for my fat foot. I got a size 13. So I can wiggle it in there and then I can sit on the desk and just use it because they don't have ankle weights at the gym I go to. But what this does, think of this, is that creating a more negative pressure inside of that joint? Is it straining the ligaments? Yes. And so more negative pressure, that means more synovial fluid production. You strain the ligaments, you increase the production. Those ligaments get stronger. Okay, and you also notice a difference right away. You can hydrate the cartilage faster. So that means all of this, the medial collateral ligament, lateral collateral ligament, the anterior and posterior cruciate. Well, here's kind of a little thing. Anterior and posterior cruciate means they cross. Isn't that cool? I know. When you learn a little Latin, it's like, oh, that makes sense. So to regenerate meniscus, you've got to distract it. You've got to cause inflammation. You've got to distract it. You've got to cause inflammation. Inflammation is not evil. It is a repair process. Anti-inflammatories are evil. Okay. Systemic inflammation will kill you. Okay, so if you eat enough stuff that inflames your arteries, you're going to die. But local inflammation is how this regenerates. You have to restore the nerve supply because that hits the patellar tracking and the calf muscle. And then you have to clean the blood. That's vital. That means vegetable juicing. That means non-toxic anti-inflammatory foods. And you have to restore the foot mechanics. Now this, trochanter supports. If you've been walking flat feet like this, If you've been walking with a hurt knee, do you think the pelvis needs to be paid attention to? Yes or yes? Absolutely. Now, here's another board question. Actually, not a board question. This was one of the questions that I did when I taught. Name the muscle that crosses the posterior aspect of the SI joint. You have to write this in. Now, one of our patients, he's the kindest, most loving doctor. He's in charge of pediatric neonatal unit. He says, don't ask me that. I said, Doc, I'm just kidding. I'm not putting you on the spot here. The correct answer, there isn't one. I know. Nasty teacher. Yeah, you would not want me. Okay, I'd make you pass the boards. So when you look at this, that joint is perfect. If there's no muscle that crosses the back half of it, piriformis crosses the front half, it's a perfect joint. And so then you get all of these people. Raise your hand if you've heard of piriformis syndrome. Yeah, it doesn't exist. Okay. What it is, muscles don't just react on their own. Okay, that's psychotic. Okay, but since it does cross a joint, if that joint's unstable, it's going to increase tone. So you've got all these physical therapists and doctors working with that piriformis, working with it instead of just looking to see. And it's super easy to find out. If you approximate the hips and it feels better, you need an SI support or trochanter support. It takes about 3 weeks to stabilize this joint. You wear the belt for about 3-4 weeks, bam, stabilized, you throw a belt away. I know, it's really that simple. Also too, to work the calf muscle, because this is going to hydrate the discs. Now a lot of people, if they're going to bike ride, they'll put the pedal on the heel. What you want is the tip of the pedal on the toe. So every time you go down, you want to flex that calf and flex that calf. And this has to do even when you're bike riding. Because I bike ride for a lot of long distances, but I bike ride slow. Okay, I have one of those recumbents, and it's really kind of neat. You're sitting in a comfortable chair, you know, listening to some training. But you got this pumping action. You're always going to be hydrating the muscles, and that hydrating the muscles, you're going to be able to go great distances without ever fatiguing out. And if you're flying in an airplane, you've got to do gas pedal, where 1 foot goes up, 1 foot goes down, 1 foot goes up, 1 foot goes down. That way you're always bringing oxygen to the joint. Does that make sense? Okay. Now this, we've used a tremendous amount of this very high-tech block. Yeah, it does grow on trees. Okay, this, honest to goodness, is a stretch for the calf that we prescribe. And we prescribe on a regular basis. Why? For unstable pelvises. Because if that calf isn't working right, you start to see this pelvis walk. Okay, so it radically changes everything. Do we give this for fibromyalgia? Yes or yes? Do we give it for difficult menstrual cycles? You'll see that tree back there with a bunch of kids on it. Okay, most of those came from women that used to be diagnosed infertile. Do you think that they have unstable pelvises? So this has brought kids into the world. I know, you just thought it was a block of wood, didn't you? Nope. And so what we look at, and this is how a normal calf is. You don't want to stretch it on a stair because that's tightening it up. You want a passive stretch. And I'll see a tremendous amount of teenagers that don't have flexibility of the calf. If they don't have flexibility of the calf, guess what's going to happen? Multiple twisted ankles, knee problems, unstable pelvises. Wait, unstable pelvis, is that difficult menstrual cycles? Yeah. Does that mean possible lack of B12 absorption, since that's the distal ileum, the lower part of the intestinal tract? So I know it, I don't want to make it sound too complicated, but you got to start looking at every symptom as a clue. If somebody has low energy, is that because the nerves in the low back that supply that little area of the intestine where B vitamins are absorbed? It is depression and anxiety because the pelvis is unstable, and that compromises the nerves that supply, that produce 90% of the body's serotonin. I know, so you start thinking, wait a second, should we check feet, knees, calf, and pelvis on every patient? You betcha. Okay, absolutely. Now, when we talk about sitting, remember, golf increases the pressure on the disc that supplies the feet 8 times normal. Sitting increases at 5 times normal. So how do we counteract that? we do this. Okay, rolled up towel, water bottle. It's placed back there for 10 to 15 minutes and taken out. 18 minutes is going to be perfect. But how long? As long as you're sitting. So we've had people that drive 3-4 hours to get here one way. So they're doing it all the way up, they get adjusted, they do it all the way back. People fly. It's going to turn flying and driving into therapy. If you're sitting or if you have an office job, the ball chair is about the best, safest that you can have. Now, here's another one. Now, what's frustrating, you can see that she had a fake hip. Now, remember I'm talking about this is the 6th, this is the 7th, this is the 8th cervical nerve root. Okay, this is T12, L3 goes to the knee, L2 goes to the hip. So when we look at this, that's an old hip injury. So if this holds true that you compromise the nerve supply to that joint, that the joint is compromised, then since that's a fake hip, she should have a problem at L2, and she does have a problem at L2. So that was missed. So you've got a profession that's actually going in there, they're saying, yeah, you got a bad hip joint, and they're not looking at why it's bad. They're not saying clean up the joint. They're not saying clean up the nerve supply. They're not saying, by gosh, let's regenerate that joint. No, give me my hammer and chisel. We'll put a new one in there. I know. So we're going to change that world. And her knees, they're going to be perfect. She's not going to have a knee, although what did the surgeon say?
It runs in the family.
It runs in the family, yeah, and you can say bad knees don't run. Okay, so it works on so many different levels. No, but when you look at this, okay, it's just those joints are not the worst joints I've showed you tonight, are they? They actually look pretty darn good. Yeah, we can fix that. Now, this is vital. Here's a patient that had microdiscectomy surgery and it didn't work. Okay, microdiscectomy is like saying a tactical nuclear war. You know, no, it's bad no matter what. You get under the knife, it's not good for you. Well, the only way to find if the nerve is compressed, you have to bend it to one side, take a picture, bend it to the other side, and take a picture. Okay, and this is called a stress x-ray. I wanted to show this one because he's got hip issues and knee issues. And those are the two discs that are out. Okay. He actually said, yeah, I don't think you'll be able to help me for my low back because I've got another surgery scheduled for my spine. You know, I just heard you're pretty good with knees. Yeah, guess what? He didn't have the back surgery. He's all better, you know, it's just, yeah, because if the knees can regenerate, if cartilage can regenerate, can discs regenerate? Yeah, absolutely, absolutely. The feet are a coiled spring. And that's why you have to restore the normal intrinsic muscles of the foot. When we look at this, I mean, bunions are not from wearing incredibly hot shoes like that. Okay, I'm never going to tell a woman to not wear high heels. Men, do we like high heels?
Yeah.
I'm sorry, let me hear it again. Men, do we like high heels?
Yes.
Good. Not to wear them, but to look at them. Okay, good. Yes, okay. So, well, we're close to Hollywood. You know, I'm not going to judge. Okay, but when you look at this, the bunion doesn't form because of the high heels. It forms from weak intrinsic muscles of the foot, not from the shoe. So keep wearing them. Okay, but the person has to restore the nerve supply in the back and walk on uneven surfaces. And bunions go away. I've got a gal 76 years old. She had the worst bunions in the world 2 years ago. And now she comes in here, she whips off her socks and says, look at my pretty feet. Yeah, they're pretty cool. And these are some of the foot exercises. Okay, we recommend like putting marbles on the floor, picking them up, walking, ripping up grass with your toes. That's going to be ideal. But use them. And then give yourself a massage, okay? And I got to tell you, if you're going to give your sweetheart a foot massage, that's 5 minutes of work. You know what the reward is? Wow. A smile says that. Okay, yeah. Yeah. Now, again, clawfoot, it's not from wearing really cool looking shoes. Okay, it has to do with the muscles and tendons of the foot are not healthy. So we've got to pay more attention to the feet. By gosh, we're on them all the time. Okay, so this means foot massages. This means healthy nerve supply. This means walking barefoot. Barefoot in the grass is vital. And plus we also have a connection with the earth. Okay, so it's good for detoxing the system. But we need to walk on uneven surfaces. Athlete's foot. This is not a problem of fungus. It's a problem with weak nerve, with an unhealthy immune system, because we all have fungus on our toes. I mean, there's a lot of ways you can treat it. You can urinate on it. You can soak it in vinegar. You can do all of this stuff. But look for the real cause. Okay, it has to do with a weak immune system. You fix the weak immune system. You restore the blood supply. Do you think you can have athlete's foot if you have a healthy calf, which has that pump in it, which allows healthy blood supply to come to it? It's really cool. You start looking at it and the real solutions. Specialty purpose shoes, I like those. I mean, rock climbing is fun. But these are the new running shoes. The new running shoes are going to have no heel pad with no arch support, because you want full motion. I mean, they're starting to experiment around with a lot of marathoners are doing barefoot marathons. And they're finding out, I mean, I'm on my feet from 4:30 in the morning until about 8:30 at night. And I have the toe shoes. I mean, I have absolutely no arch support. Why? Because they're the best thing biomechanically for my body. These are the best toe shoes around. And if you happen to be blessed with duck feet or size 13 or greater, okay, like me and my boys, get them on sale. Don't ask for color, just ask for size. Yeah, size 13, you don't have a lot of choices. Okay. But you can get them on the sale rack. Okay, this is going to be one of the most advanced ones out there. But these also are flat with full range of motion. So I truly, they do look attractive. I know. But some people don't like them. Okay. And also too, when we look at gout, fungus, diabetes, it shows up in the feet first. Why? Because it's the furthest point away from the heart. So when we look at toes, we look at the health of the feet. I'm looking at the health of the blood. I'm looking at the health of the calf. Do you think somebody's going to have gout, toe fungus, or diabetes and have a good pelvis? No. Do you think they're going to have a healthy nerve supply? No. So you're looking at this as the end result of chronic system toxicities. Now, this is phenomenal. You got to clean the blood with healthy juicing. This stuff, Great Lakes gelatin, is one of the best to restore normal. It gives your body the building materials, particularly if you have mainly a plant-based diet. Great Lakes gelatin is just about one of the best sources. And you got to figure like $30-35 worth of gelatin is going to last you 4 or 5 months. And I mix it in coffee. I mix it in soups. It's great. Online. Yeah, it's fantastic. And now here, these are 4 different patients, the side view of the lumbar. A normal disc has a space, but we're looking at compression. All of these patients, they had either depression, anxiety, prostate issues, bowel issues, bladder issues, low energy issues, back pain, foot pain, pelvis pain. Where do you think it started? At the disc. Now, can discs regenerate? Yes or yes? Yes. Yeah, cartilage can regenerate. The body's alive. It doesn't have any dead tissue. So when you restore the discs, you restore the nerve supply, you restore the nutrients, you stabilize the person. Isn't that cool? I know. This is going to be the future. So this is what your body requires. You require healthy nerve supply. Why? L3 to the knee. Anyone with a knee problem is going to have a third lumbar. If you got hip issues, it's going to be the second. Okay, it's just like drawing a map. I've showed you a dozen cases tonight. I could show you hundreds of them. They're all the same. Regular exercise. This means to work the joints and work the ligaments. Okay, and it could be as little as a half-hour walk in a day. Proper nutrition. This means a plant-based anti-inflammatory diet, because the health of the blood is going to denote the health of the organ systems. And then we get sufficient rest. This is something I'm experimenting around. Normally I have about 4.5 to 5 hours of sleep. I've been trying to get 6 to 7 hours of sleep. It's a weird experiment. Yeah, and prayer and meditation. You got to do it. That's daily stuff, because your attitude will generate tissue. Depression and anxiety is going to cause an alteration in digestion. It's going to cause an alteration in neurotransmitter function, and it's going to cause an alteration in cell metabolism. So this thing will actually help regenerate the tissue vitally. Now, all of this stuff, all of these, the handouts, everything that we do are available, okay, on our owner's guide site, and this is for everybody on YouTube and all our patients. Spread the news. How many operations could be stopped from just simple understanding that an anti-inflammatory diet? Or how many doctors will now start looking at the pelvis instability as a part of flat feet or bunions? If you see someone with bunions, do they have weak intrinsic muscles? Do they have a low back problem? Yes or yes? I know, it gets kind of cool. It's all detective work. Yeah, all of this can be fixed. It's like vital. And also too, and next week we're going to talk about vaccine rights and the legal loopholes.